Anxiety, fear of contamination or dirt, aggressive and unwanted thoughts on sex or religion, horrible thoughts in losing control, setting things in order and symmetry, doubting, and struggling with uncertainty. These are only a part of what it's like living with OCD. Today, I would like to talk about how obsessive compulsive disorder disrupts daily life. I will first discuss how OCD disrupts daily life, followed by explaining the causes of these problems through research studies and articles. Lastly, I will discuss the various treatments for OCD to prevent it from disrupting daily life. As stated on the website ocduk.org, obsessive compulsive disorder is a serious anxiety related condition where a person experiences frequent, intrusive, and unwelcome obsessional thoughts, commonly referred to as obsessions. These are very distressing and result in a person carrying out repetitive behaviors or rituals in order to prevent their perceived harm and or where the preceding obsessions have focused their attention on. Such behaviors include avoidance of people, places, or objects, and constant reassurance seeking. Sometimes the ritual will be internal mental counting, checking of body parts, or blinking. All of these are compulsions. OCD is not always visible, and having these obsession and compulsive thoughts and actions happen daily, if not routinely. Furthermore, this disorder is actually defined as an illness that disrupts normal physical or mental functions. Additionally, a study entitled Sleep Disturbances in Obsessive Compulsive Disorder, Influence of Depression, Symptoms, and Trait Anxiety from BMC Psychiatry, posted on January 14, 2021, found the existence of sleep disturbances in OCD, trait anxiety, and depression play a key role in sleep quality among OCD patients. Lastly, the article entitled Obsessive Compulsive and Related Disorders from the Gale Encyclopedia of Mental Health, posted on 2019, explains that OCD can start at any age, even in childhood. It was stated that between one third and one half of adults diagnosed with the disorder said that their symptoms began in childhood. However, the most common age of development of symptoms ranges from 10 to 24. Can you imagine how that's like? Living with OCD with these symptoms impact their lives, and it's a problem that demands treatment. Otherwise, every day will be disrupted. Now that you understand how OCD disrupts daily life, let me explain the causes through research studies and articles. The World Health Organization actually ranked OCD in the top 10 of the most disabling illnesses of any kind in terms of lost earnings and diminished quality of life. The same report also said that OCD was the fifth leading causes of disease burden for women ages 15 to 44 in the developed world. Moving on, in the early 20th century, Sigmund Freud thought that OCD was caused by punitive, rigid toilet training that led to internalized conflicts. However, this is not considered anymore. Today, the most recent theories on the causes of OCD are generic: abnormally low levels of serotonin in the brain, differences in brain structure, and infections. But unfortunately, there hasn't been a concrete explanation for the causes of OCD. But researchers continue to study it more today. These have been further studied in obsessive compulsive and related disorders from the Gale Encyclopedia of Mental Health. Now that we've been in the middle of a pandemic, a study entitled Obsessive Compulsive Disorder and Reaction to the COVID-19 Pandemic was conducted, in which they found that OCD symptom levels significantly predict COVID-19 related anxiety and adaptive and maladaptive behaviors. The key to finding the cause of OCD is research. And although we have advanced in understanding OCD more, there is more that we have yet to discover. Now that you know the current status of studying the causes of OCD, let me share the various treatments of OCD to prevent it from disrupting from daily life. A study entitled Multi-Level Assessment of Obsessive Compulsive Disorder reveals relations between neural and neurochemical levels, posted on November 25, 2020, found that the obsessive compulsive, depressive, and symptom severity of OCD was significantly reduced after psychotherapy. Moreover, medications and alternatives are also options. The alternative consists of yoga, massage therapy, batch flower remedies, traditional Chinese medicine, aromatherapy, and Sculptor tissue salts. For some, surgery is also an option if medication doesn't work. There hasn't been a concrete cure for OCD, but there are various ways of treatment and handling it to prevent it from getting worse. Moreover, according to the National OCD Foundation, the most effective treatments are cognitive behavior therapy and medication. The CBT is significantly called the Exposure and Response Prevention, or ERP, which is said to have the strongest evidence supporting its use in treating OCD in a class of medication called serotonin reuptake inhibitors, or SRIs. Lastly, according to the American Psychiatric Association, self care can help cope with OCD, such as ensuring a healthy lifestyle. Also, caregiver interventions help with the exposure practice, and lastly, neurosurgical treatment such as deep brain stimulation is recommended when people with severe OCD do not respond to other treatments. As you now know, OCD disrupts daily life. First, I discussed how OCD disrupts daily life. Then I talked about the causes of OCD through research and studies and articles. Finally, I explained the ways in treating OCD to prevent it from disrupting daily life. Living with OCD is difficult, but not impossible. Treatments are here to help live a meaningful and happy life with OCD. It's time that we become more open to this and support those who struggle with it. Thank you very much.